Are you treating your back pain wrong? Back pain is one of the most common reasons people visit doctors, miss work, or avoid physical activity. But despite its prevalence, many individuals unknowingly treat their back pain the wrong way. Mismanagement of back pain can prolong discomfort, lead to chronic issues, or even cause new injuries. So how can you tell if you're treating your back pain incorrectly, and what should you be doing instead? One of the most common mistakes people make is immediately resting too much. While it might seem logical to lie down and avoid movement when your back hurts, extended bed rest can actually make things worse. Staying immobile for too long can lead to stiff muscles, reduced blood flow, and slower healing. In fact, current medical guidelines often encourage gentle movement and light activity within a day or two of experiencing back pain. Walking, stretching, or low-impact exercises can help maintain flexibility and support the healing process. Another frequent error is relying solely on medication to mask the pain. Over-the-counter painkillers like ibuprofen or acetaminophen can provide temporary relief, but they don't address the underlying cause. Worse, they can sometimes allow individuals to push through activities that might aggravate the problem, potentially leading to further injury. Medications should be used wisely and in conjunction with other treatment strategies, not as a standalone solution. People also often ignore posture and ergonomics, both at home and at work. Poor posture when sitting, standing, or lifting can place additional stress on the spine and surrounding muscles. Sitting hunched over a desk for hours or lifting heavy objects without using your legs can quickly lead to or worsen back pain. Investing in ergonomic furniture, adjusting your workstation, and being mindful of your body mechanics can prevent unnecessary strain on your back. A surprising yet significant mistake is not seeking professional help soon enough. Many people try to tough it out or self-diagnose, hoping the pain will disappear on its own. While some back pain does resolve without intervention, persistent or severe pain should be evaluated by a medical professional. Chiropractors, physical therapists, or orthopedic specialists can help pinpoint the source of the problem and develop a tailored treatment plan. In addition, neglecting core strength and flexibility is a long-term treatment error. Your core muscles, those in your abdomen, hips, and lower back, play a crucial role in supporting your spine. Weak or imbalanced muscles can contribute to pain and increase your risk of injury. Incorporating exercises that build core stability and improve flexibility, such as yoga or Pilates, can be a game changer for managing and preventing back pain. Lastly, emotional stress is often overlooked as a contributor to back pain. Chronic stress can lead to muscle tension, poor sleep, and changes in behavior that negatively affect physical. Like, subscribe, follow for your free back pain relief ebook.